So for the practicum, I looked at sexually transmitted infections, specifically chlamydia, gonorrhea, syphilis, and HIV and AIDS. So I looked at those infections in those 12 counties in the Peter region, and those 12 counties include Chesterfield, Clarendon, Darlington, Dillon, Florence, Georgetown, Horry, Lee, Marion, Marlborough, Sumter, and also Williamsburg County. I also looked at the incident of these infections in rural geographic locations and certain ethnicities, particularly the minorities, and also in adolescents and young adults. So my practical focus was to reduce the incidence of STIs by 5% and increase the HIV continuum of care by 5% in adolescents and young adults, and also in racial and ethnic groups in 2 years. And the last one was to implement a mobile unit in rural areas of the PD region to increase access to care by 5% in 2 years. So the Department of Public Health, they already had this initiative going, that mobile unit. It hasn't been started yet. They're just trying to work out the logistics. So my goal was to actually research those areas with those counties to see which unit, which county needed the unit first. And to put things in perspective, so Williamsburg County, they don't have a hospital in their county. So the closest hospital that they would have to go to is Florence. And the distance is about a 45-minute drive. I also looked at the access to vehicle per county and the individuals. And when I say access to vehicle, that doesn't mean just a car in the yard. That means if they know someone in the area that has a car and they're able to use it. So just looking at that, a lot of them didn't have access to a vehicle. So in Williamsburg, if the closest hospital is Florence, but if you don't have access to a car, that makes it really hard and a barrier for them. So that's why I suggested Williamsburg County getting the unit, and to also put things in more perspective, Horry County, which is the highest paid county, they have access to 3 hospitals. And I would like to point out that I didn't specifically collect data for this practicum. The data that I did utilize was from sources that I have bullet pointed right here. And I utilized that information from years 2019 to 2022. So I didn't go back too far. I wanted the most relevant data. And from years 2019 to 22, that's where I found it. And if you look at the graph or the table to your right, so it's from the American Community Survey, which is also known as the census. And I just looked at the populations living below the federal poverty line. It's hard to see, but if you see South Carolina federal poverty line was 14.40%, and all of the counties didn't populate due to me not making the graph so big. But you can see that every county that you see listed is above the federal poverty line. But if you see the 13.10%, which is right under South Carolina, just from my knowledge, I do know that was Horry County. And like I said in the previous slide, Horry County is the highest paid county in the PD region of South Carolina from those 12 counties listed. The biggest key takeaway from the practicum experience was to know that the social determinants of health played a role in why sexually transmitted infections were highest in certain counties, and adolescents and young adults, and by ethnicity or race. And when I mention of social determinants of health, I mean poverty, like the graph or the table in the previous slide. You see the federal poverty line in every county, except Horry County was above the federal poverty line compared to the state's average. And like I said, I also mentioned in that second slide of that mobile unit and access to care. Like it's only one hospital in Williamsburg County compared to 3 hospitals in Horry County. So I looked at the findings from the sexually transmitted infections per county. And if you look at the graph or the table to your left, so the 3 most affected for STIs out of the 4 topics, which was chlamydia, gonorrhea, syphilis, and HIV, Williamsburg County ranked the top. Lee and Marlborough ranked below Williamsburg. Dillon, Clarendon, and Darlington ranked in third place for the most effective for STIs. And like I said, I also looked at sexually transmitted infections by adolescents and young adults. So if you look to your right, in 2022, the top 10 counties with the highest rates of chlamydia cases in teens, um, top 10, well, number 10 was Marlboro and number one was Allendale. I put in asterisks the counties that I actually study within the PD region, and those were Marlboro, Clarendon, Marion, and Williamsburg once again. So there, Williamsburg is highest per county and also in the teens. I also looked at the findings of sexually transmitted infections by ethnicity and race. I don't have a table for that one, but the table that I did find, it was for HIV testings. And the question asks, have you ever been tested for HIV? And that graph, if you take a look at my project paper, you will see that graph in there. Based on those findings of the sexually transmitted infections among those counties and adolescents and young adults, and also the ethnicities, I was able to research interventions and strategies that could potentially improve those rates. Behavioral and educational are pretty self-explanatory, but the main big one that my supervisor over at DPH wanted me to do was to just research other states to see what they're doing to keep their numbers low. So I was able to look at North Carolina's plan to end HIV, and they had three pillars. The first one was to engage and embrace, and that was to increase access to antiretrovirals in those that are living with HIV. The second one was to test and treat, and that was to identify those that are at risk for HIV and to potentially get them on PrEP. And the last one was the policy and promotions, and that was just to increase youth programs in the area or in that state. And based on those three pillars, each one had action steps to carry out that same strategy. And that was a real big one. And I was glad I was able to, find that state's plan to take back to South Carolina Department of Public Health department as well. So I identified those pillars and it actually listed more action steps to carry out that same one, just in case SCDPH wanted to, utilize that information. What I do recommend for anyone else going forward was to just do additional research for the entire state. I know for this practicum, I was just to focus on the PD region because that was closest to my area. But it's 46 counties in South Carolina, but I only focused on 12. So just researching all the counties within South Carolina could show the bigger picture. Also, when I looked at the counties, it just showed the counties. I wasn't able to break it down by the age, gender, or the ethnicity. I used South Carolina as a whole for the age, the gender, and the ethnicity. And the last recommendation was to do research on another state. So I did research on North Carolina, but just researching another one that's close to us, potentially Georgia, could be great for this practicum, or just to look at the bigger picture of SCIs as well. And for the practicum, I identified three foundational competencies. I won't go into detail about which one. You can see them listed on this slide. But the main thing that I learned was from the sources that I used, it wasn't just typing into Google, look at their website. You really had to dig deep to find the data. And I found it really interesting because when I did, find data, it was more data within that I wanted to research. So for, I could say the first month and a half, it was basically just me looking at data, and I knew that I had to tighten down and actually develop these strategies for these populations that I identified. And the last and final slide is my global health competencies. The two that I chose were able to complete this practicum, but the main key takeaway is the data that I utilized and the research that I conducted through interventions will be used for DPH results-based accountability evaluation program and also the STI initiative action plans. Thank you.